So anyway, first we will be talking about the gap concept. Let me first acknowledge my co-authors here. Saurabh, he's a postdoc at UNL, and Bharat Acharya, he's a scientist at Oklahoma Department of Mines. Um, this is a benchmark for soil health management that we have proposed. Um, the whole idea of this comes from our basic soil test that we do, right? In early 80s, so much effort were put into uh, developing soil test, a lot of trials after trials to correlate, calibrate our soil test, what 40 pounds of nitrogen in soil 4 feet deep means, right? So all those nice work was done for soil test with regard to so many other nutrients. So when it comes to soil health, again, it's again a measurement, it's again a soil test. So some food for thought, right? Do we also need to do all that series of soil test background work when it comes to soil health measurement as well, right? We have let's say, some kind of soil health index, Hanny test. What does score of 6 means in Hanny test? Do I need to raise it to 7? How do I do it? So all this calibration correlation, will we have to do someday when it comes to soil health as well? Um, and on the same line of thought, this is, I assume, one of those series of benchmarks that will evolve, that will develop as we progress in terms of measuring and improving our soil health. So soil health gap in nutshell, it just means what is our actual soil health, irrespective of how you measure it, based on a single parameter or a series of parameter as a function. However we measure the soil health, what is actual status of it in our cropland compared to the potential status. Have we had done everything perfectly what we could have achieved in terms of soil health, and whatever is the missing gap, that's what we call soil health gap. So let's get into the discussion. Soil health has been around. This is not a recent topic. Century ago, people talked about soil health. The definition has evolved. This is the definition from NRCS. And just like human health, not easy to really put into a series of words, right? What is a healthy human? A sprinter, a marathon athlete, or a good swimmer? Who is a good, healthy person? So it's really depends on the functionality. Soil as a resource functions in so many areas of ways, but NRCS has this definition which says this continued capacity of soil to function as soil maintain plant, human health, animal health. Uh, in the process of that, it may lose some health, but if we can intervene and manage it well so that soil can continue all its ecosystem services. That's what soil health is. And a lot of conversation is out there in terms of definition itself, right? What is the value in a soil? It really depends who is looking at the soil, right? Um, we want soil to infiltrate water, but an engineer, construction engineer, may not want that, right? He wants a very compact soil so that the building structure can stand on it. So it's really what is the value of the soil when we talk about soil health. So I personally like when we also include a phrase within land use boundaries. So depending how we are using the land, accordingly, particular health aspect of soil will be interested in. And as I understand, our group here is pretty much from ag background. So from agricultural perspective, we have certain sets of ecosystem services from the soil that we are interested in, right? We want soil to be healthy such a way that it cycles nutrients properly, filters water, uh, uh, filters the pollutants, give a good support to the plants, good bedding for the soil proliferation. But in nutshell, as we study soil, though it's a very um, interconnected continuum, but we still keep them in a separate the soils into discrete sections like soil physics, soil chemistry, soil biology, and all these properties interact and processes are formed, which eventually provides us with different services. And for soil health measurement, not that we devised any new soil test. We pretty much rely on the existent soil tests, be it physical, chemical, or biological. So, based on these properties or some processes, we measure soil health. So, these properties, processes becomes the soil health indicators. And indicators can be measured, qualitatively or quantitatively. If my farmland has a water pool standing on it, then I can either go and quantitatively measure how is the infiltration in that piece of land, or just qualitatively I can look around and see if there has been a runoff, maybe some rills and gullies are being formed in the across the field, and I can determine, okay, here a lot of runoff is happening, soil is not good in terms of infiltration. So measuring these indicators gives us our insight to the soil health. And all these indicators are one way or other tied to soil health in various ways. Among these indicators, probably organic matter or soil carbon really tops up the comes top on the list, since carbon is so intricately related to all three physical, chemical, and biological facets of soil, right? Organic matter is responsible or uh, helpful for soil fertility, root proliferation, for the soil physical structure, stability, thereby comes water infiltration. So organic matter is probably one of the indicator that relates to soil health in many, many ways. So why this topic of soil health gap? Certainly, as somebody said, right, if you cannot measure something, then you cannot improve it. So we really need to keep making progress in terms of identifying key primary soil health indicators that are important to infer to soil health. Of course, all these measurement tools will be very important. I assume some might be working towards even developing index that will be a function of several indicators. It will be complex, of course, but it will account for many, many more indicators and give a single number and will help us to understand how healthy or unhealthy our soil is. So that progress has to keep going on. But my point is, since we don't have any benchmarking system for soil health yet, most of our research is directed towards just evaluating different management interventions to improve soil health. And I would also argue that because of the lack of benchmarking, we really don't know what's the goal we are setting out for, right? Sometimes we may be overestimating our goal or underestimating our soil health goals. So, benchmarking, I assume, would certainly help us to understand how much the soil is unhealthy and how uh, how high I can aim for soil health. Just imagine, if in our human health, if there was no number, what is high BP or low blood pressure, 120/80. If we didn't have 120/80, that margin, then how would we have even taken our medical pills, right? To know that I'm taking care of my high blood pressure. So having that kind of benchmark numbers, I think would truly help our soil health management attempts. Um, some more food for thought in terms of benchmarking. Um, I'm sure most of you, if not all of you, recognize this kind of graphs uh, in the process of developing the soil test. We've gone through the many iterations of this kind of work, which calibrates our test, and we realize when any management effect will management intervention will affect the response. If your soil test is at the very low category, then very likely bringing in some management intervention will certainly uh, raise your response variable, whatever you are looking at. So my thought is, will we have also that kind of benchmarking, the threshold values, which will give us the limit beyond which management practices will affect soil health? And these points I find very interesting because as we monetize, as we put monetary values on soil health practices, right? There are already payment systems where farmers adopt certain soil health conservation practices. They get paid for the work. But when it comes to the um, uh, putting some numbers on the progress of a producer makes, let's say my my carbon in the soil was 2%, I raise it to 3, and because of that, I get credit for 1 extra %, and accordingly, I get a monetary reward. But what if there are farmers who are already managing their field so well that it's very hard for them to increase their organic matter by 1%? How do you reward them? Just because they manage their field so well all this time, now they cannot show that abrupt gain in whatever health aspect we are looking at. So how do you reward those people, right? Certainly unhealthy soil will benefit faster. So what about the healthy soil? So this kind of calibration curves will make us think that, you know, we have to improve soil health, but what about who have been maintaining that soil health pretty well? How do they reap the benefit of their past good deed? Um, there can be critical values, as you monitor your field. What is the point, the breaking point beyond which, if you don't intervene, if you don't bring in some conservation practices, your soil is really going to deteriorate? Will we have someday numbers like that, Um, but today's topic is soil health gap, a very simple, assume very intuitive concept, but I think yet it will be powerful concept to use. Uh, Concept here is a native soil, maybe under prairie or forest line, over years and years under the influence of climatic conditions, whatever has happened to the soil health there has already attained some kind of steady equilibrium. But when you come to the farmland, because of our cultivation, everybody cultivated in the beginning, plowed, and then intensive agriculture with all the mechanization we have available. In the process of food production, most likely the farmland has lost some of its health and thereby has a lower soil health score compared to the native land. And thereby farmland has some ecosystem services compromised, maybe organic matter has gone down, maybe water holding capacity is lowered, maybe the microbial communication has been altered. Um, so soil health, however we measure it, as I said earlier, maybe as a function of several indicators or just based on a single property, that measure would be higher in the native soil than in the farmland. And whatever the difference, that would be the soil health gap. Of course, there will be certain exceptions. If in a very arid area, you brought in irrigation and started growing crop where otherwise nothing could have been grown, certainly soil health might have been actually enhanced in the cropland. But in most area, it's, I think, safe to assume that the native land would have a higher soil health indicator value than in the cropland, and the difference would make the soil health gap. So in mathematically, if you put it, soil health gap would be the difference between soil health in a native land and the managed land. And that soil health can be measured as a function or as a single property. And for a very, it's already easy concept, uh, only if we will soon really put one good number on soil health measurement. Uh, but for make it even easier to understand, I'm showing here soil health gap in terms of carbon. So what would be the gap? Gap would be pretty simple: soil carbon in the native land minus soil carbon in your cropland. And to just as a proof of concept, we did a short, very quick soil sampling analysis in a Scottsbluff County. Within 10, 15 miles this radius, we collected the top 18 samples from undisturbed native prairie, no-till farm. So no-till farm was under no-till for 15 years, for last 15 years. Conventionally till farm where, plowing was there, and a farmland with exposed subsoil. So in western Nebraska, we have quite a rolling hill, so sometimes farmers they level off the farm just for the ease of management, and thereby subsoil may get exposed. So we just measure organic carbon. Probably I'm stating very obvious thing here, from grassland to no-till to conventional till to exposed subsoil, organic carbon has exponential decline, which is, very obvious. Everybody kind of knows about it. But what is simple yet very powerful in this kind of understanding is that now compared to the grassland, how much carbon has been lost from the topsoil. So that gap for no-till is about 2.2%. And for conventional till, it's little higher. And more higher is in the exposed subsoil. So our thought processes here is that not only we know how much that we have lost carbon as we increase the intensity of the tillage, but now we know how much the carbon in that topsoil would have been had we hadn't touched that ground, had we had left that soil untouched. And that reference is coming from the grassland. So this is the soil health gap in terms of carbon, 2.2 for no-till and little higher for conventional till. Now we can think about the management schemes to build up that carbon back to the native land. Some may over target and say, let's go for even higher than in a grassland. Maybe that's also possible, but very likely as a function of weather and climate, things may get equilibrated back to carbon level that we have in the grassland. And this is a slide I borrowed from Sky Wills. She's an RCS soils leader in DC. They have quite a bit of data on this regard. Here you see data from one side, phospholipid fatty acid test for perennial, no-till, and till. Again, maybe this is again obvious, but now we have a data to show that perennial grass has, soil under perennial has more microbial biomass compared to no-till, and then till has even less. So what can we deduce from data like this? We'll go back to yield gap. That's where the concept of gap is borrowed from. So in a yield gap, what we do is you have an actual crop yield in a farmland, and then there's a potential yield. Given all the factors affecting crop yield is favorable, the highest potential yield we have. So that difference between potential yield and actual yield gives us the yield gap. Just because that gap is there doesn't mean we can fill the whole gap. So in this plant science data, we know that probably we cannot fill the 100% of the gap. There will be something in between, which is attainable gap. So this concept from plant science, crop science, is borrowed to soil science, and there is a paper here by Ingram and Fernandez where they use the same concept for carbon sequestration. Actual number of carbon is there. Potentially, how much carbon can be sequestered? That's a higher number. But with all our management intervention, probably attainable carbon sequestration will be somewhere in between potential and actual carbon. So, with that same concept bringing to the soil health gap, we have this ecological potential, how much microbial biomass can be improved in the soil. That's from the reference site of perennial grass. And then we have actual microbial biomass from no-till plots. So that difference would be the soil health gap difference in terms of PLFA. And now we can intervene with our conservation management practices, and probably we won't make all the way to the potential limit. Somewhere in the middle, we will improve our microbial biomass population in the no-till plot with the introduction of soil health management. So this is the concept. Soil health gap at least gives us the highest target we can aim for when it comes to soil health management. And then with our conservation management, how much we can attain might be something below that potential. So I see quite a bit of opportunities. This idea can be, scaled up on a reasonable level, or regional, or even national, global scale. And what this will do is show you where is the gap is extreme. So that allows us to prioritize our soil health efforts. The sicker the patient is, probably we have to pay attention to that acreage quicker and faster. Certainly challenges will be there. Maybe it will be hard to find native land close by your cropland, not everywhere. So probably we might have to get creative over there to find which reference site we can use. So I've been working with NRCS. NRCS has a lot of data points. They have something called ecological sites, which is just sites for each of which they have a soil descriptions and the native plant communities descriptions. So we can go to those sites and look for the reference values in terms of soil health, and then compare that against our cropland soil health values to see how far we have straight off from the native land situation, and then inform our soil health management practices and goals. So with that, I think I'm a little off the time, but it's a very simple concept, but yet I hope will be useful. It's a free downloadable paper. You can visit to the journal Global Ecology and Conservation, or visit our webpage agronomy.unl.edu/Maharjan.